Part of the basis for this study was to figure out how do we change the game in patient safety? How do we create clinical environments where it is just impossible, perhaps, for those errors to occur? So when I use the term supply chain so often with my clinical colleagues, they don't necessarily know what I'm referring to. In nursing school, we don't have supply chain and logistics courses. I'm pretty sure medicine doesn't either, or any of the other clinician programs. And one of the reasons healthcare is so far behind is because we simply do not know what we don't know. Let's talk for a moment about adverse event reporting. One of our issues is we don't report these as frequently as they happen. Alberta are absolutely leading the charge in supply chain and adverse event reporting. They moved from manual events, they got about 1,400 events a year. As soon as they digitized, made it easier for clinicians, go online, fill in what happened, it jumped more than double, 3,400 per year. They always get 3,500 from external notice recalls, either from Health Canada, FDA, or manufacturers who are legislated to report them. 2,300 of these a year must require responses and action by our clinical settings. That's a very big number. So when we move from manual to digital and we more than double our adverse event reporting, that would suggest to me it's not about clinicians not being willing to report. It's about creating an environment where it makes it easy to report. What's common in all of the safety events we do have reported? They are not well documented. They are essentially invisible. So what I'm suggesting today is we need to build on the strengths of the work we have done in patient safety in this country. We are one of the most highly educated populations in the world. Our healthcare professionals are sought after worldwide. It's not about the clinician teams. It's about the infrastructure in the environment. When I'm delivering medications to those 8 patients at 8 o'clock in the morning as a nurse, there's an average of 40 to 60 different medications I'm handing out that I scan that ID band for the patient, I scan that medication, and then I instantly get the green light, right medication, dose, time, right patient, or I get the red one that says, no, it didn't scan appropriately, something's wrong, and it proactively lets me know that to prevent the error from happening, not waiting for it to happen, and then figure it out after the fact, which is what we do now. What do I mean by a highly visible healthcare system? A system that first and foremost, and this is for the policymakers in the audience, and thank you so much for joining us, adopt global identification standards, which is essentially the numbers in the barcode. If we have a unique identification number on every product in every clinical setting, it's a global business, we can track it anywhere in the world. Every country I've spoken to have shared with me the single most important step in starting down this road of supply chain transformation in healthcare is that one. Adopt global standards. The only one that's global, that transcends not just health products, but those drugs in retail pharmacies and food and grocery stores, is the GS1 barcode. As soon as we do that, it creates the momentum we need. For every dollar you invest in supply chain infrastructure, like barcoding and adopting standards, you get an $8 return on that investment. It actually pays for itself, and they haven't yet calculated what savings do we have for all of those errors and adverse events that we're now avoiding. So what are some of the solutions I'm proposing? Not shockingly, the very first one is we have to mandate the adoption of global product standards. If we don't do that, we have no global language to identify anything. Products, patients, providers, or care processes. It is the catalyst every other country in the world has found has moved forward very quickly. The second thing, invest in those digital scanning infrastructure. Remember, if you're saving $8 for every dollar you're spending, it actually pays for itself. This is a rare statement for a researcher in a healthcare innovation world to make, because usually innovation is expensive. This one is critically important if we're going to proactively create the alerts clinicians need to make very sure that it's almost impossible to make those errors and to prevent them. The third thing, many countries have established a digital product registry. Why is that? Right now in the US, there are 10,000 joint implants on the market. In Sweden, there are 6. In the UK, there are 100. Why is that? Because Sweden and UK have joint registries. They analyze that data regularly to know that those 6 or those 100 have the best possible outcomes for patients. They're the only ones we're going to use in these clinical settings. We have no such thing. 10,000 different joint implants, you have much less of an ability to do so. Number 4, we need a visibility scorecard. How well is your supply chain in these respective clinical organizations and health systems operating? What value does it achieve? Supply chain and logistics is much of the research business schools have been doing for decades. The problem is they just haven't been doing it in the health sector because health hasn't always been viewed as a business. Thank you to the support for University of Windsor, however, they see that as very central. And having something to measure your progress against, you cannot manage what you don't measure, and a scorecard helps us get there. Number 5, the next generation of leaders coming out of our business schools and our health disciplines have to understand what is the value and the importance of a strategic supply chain. If you have a measurement scorecard to do that, all that much better, but preparing the next generation of leaders to work with us, engage our private sector colleagues who've been doing this for decades. 30 years ago, they put a barcode on Wrigley's chewing gum. 30 years later, we're still waiting for the barcode on any health product. For me, that's a little bit of a showstopper. And the last thing, which is uniquely Canadian, although I try not to be uniquely Canadian because we share many more challenges than we're different, but we're a small country. We're 2% of the pharmaceutical market. If we don't align our policy frameworks with other countries, particularly our colleagues in the US, we risk not having these next generation and best available products available to us. The more collaboration we're able to achieve with these countries, the better. And the basis of my talk today is really to invite you, to engage you, and to hope that you'll work very closely with us to making sure that never happens again for any one of those families. Thank you so much for coming today, and I look forward to working with each one of you.